Welcome to tonight's Diabetes Chat. Tonight we are joined by Varkha, Amar and Dominika, and we'll be talking about diabetes oral health, and we'll be talking to the guys about the importance of it. We'll be talking about annual check. Should it be mentioned more in clinic? I think it should. We'll also be talking about the guidelines and NICE as well. And we've got lots of different questions about it as well. So if you want to get involved tonight, you can hashtag Diabetes Chat if you are listening live. And if you are listening on the podcast, you can obviously tune in and send us a message and you can get in contact with our speakers tonight. Hope everyone is doing well. I think it's a very important chat. Thank you to Dominika for setting up today's chat. So what we're going to do is, I was going to do a little introduction, but I'm going to just hand over to you guys. I'm going to start with you, Dominika, just quickly for a minute or so. Could you just introduce yourself, who you are, your connection to diabetes, and particularly your interest in oral health? What is your connection there?
Hi everyone, so I'm Dominika. I'm a dentist with a special interest in periodontology, so everything related to the gum disease. And I'm also a person living with type 1 diabetes, so that's my connection to diabetes.
Thank you so much. And Varkha, could you introduce yourself to the community tonight?
My name is Varkha and I'm a final year postgraduate at King's College London. I'm doing my MClin-Dent, so Master of Clinical Dentistry in Periodontology. And my interest in periodontitis and diabetes started when I essentially started a campaign about periodontitis and diabetes and trying to get medical professionals involved.
That is so important, and we'll be talking about that tonight. So thank you for your hard work, both of you, in this important field. And tonight we're also joined by Dr Amar Puttanna as well. Hello, Amar. Could you introduce a little bit about you and your connection to diabetes and in particular oral health?
Yep, no worries. Hi, everyone. So Amar Puttanna. I'm a diabetes consultant. Have been so for a while now, about 7 years. But I've been interested in diabetes for a long time. I have been on Diabetes Chat before and talked about older adults and diabetes. That's one of my areas of interest. But specifically to oral health, I guess it's been quite some time. I'm drawn to areas where there's not as many people highlighting the links and areas where things can be done to improve care. And this was one of those areas that I noticed quite earlier on. And together with a few like-minded individuals, we're again very much campaigning for more awareness of the impact of oral health and diabetes and vice versa. And been involved in a few projects with both my fellow speakers and a few others in the dentistry world and diabetes world. So pleasure to be here and speak to you all about this.
Thank you so much. So let's kick off then. Whoever would like to go first. So we're going to have a bit of a panel chat. If anyone has any questions, you can hashtag Diabetes Chat or request a mic. So what is periodontitis? How is it connected to diabetes? What are the signs, the symptoms, and how do you diagnose it? How does that come about?
Okay, so I can start.
Go for it, Dominika.
So basically, periodontitis, just like diabetes, is also a chronic condition. It is caused by bacterial plaque buildup along the gum line, and it leads to inflammation. We can see it in the form of gum recession and eventual destruction of the supporting bone around the teeth. And one of the key risk factors for periodontitis is diabetes, but also smoking, as well as genetic predisposition and imbalanced immune response. Varkha, Amar, do you want to add anything?
Yeah.
So I guess I'd also say the one thing to note about this is, so periodontitis is inflammation, and what we do know is diabetes itself is a state of increased inflammation. It has associated with increased inflammation in the body. So there are links between periodontitis and diabetes from an inflammatory point of view. There's a link between periodontitis, and other conditions in the body as well, which cause it with increased inflammation. And this is a two-way relationship with diabetes and oral health. So one will impact the other. That's what it means. So a deterioration in one can cause a deterioration in the other, and vice versa. So it's important to be aware that they're both linked and they both have an impact on each other. And from a diabetes side, certainly when we're managing patients, when we're seeing people with diabetes, it's important that we're aware of this, that they kind of go hand in hand in a way, and we can talk about that in a bit more detail when we look at some of the guidance and some of the other things. But from my point of view as a diabetologist, that's the thing.
Yeah.
I've just got a message from Varkha saying that she's unable to unmute herself on the mic, so that would explain why she's not spoken yet.
If she maybe jump back on and see if she can regain connection, hopefully, Varkha, if that's okay, because unfortunately I can't do it from my end. Amar, can periodontitis, is that in all types of diabetes, so type 1, type 2, etc.? Like, can it affect all types of diabetes, or is it more likely in type 1 or type 2, or a little bit on that if you can?
Yeah, so I guess what's interesting here is that we know about the links between oral health and diabetes for some time, but still, if you look at the bigger picture of things, it's still a relatively newer area compared to the traditional risk factors or complications in diabetes, such as nerve problems, eye problems, kidney problems, things like blood vessel problems. So it's something that we're getting more and more understanding of. So they're looking at it across diabetes, and we know that.
Yeah. Yeah. No, that's really interesting. So does it like particularly affect, what aspect of diabetes can it particularly affect? Does it like affect like the glucose levels? Can it affect like levels going a bit higher, or like in terms of like A1C and stuff like that? Does it have impacts in them sort of metrics, or is there other elements of your diabetes that it can impact?
Or that results in improvement in HbA1c.
Mm-hmm.
They've done some trials looking at such as even just brushing your teeth regularly is associated with a difference in HbA1c. I know HbA1c isn't the be all end all. I appreciate that, but this shows that there's some parameters that that can be linked, but also that periodontitis as well. So any inflammation, so the deterioration in periodontitis, so active kind of disease process, let's say, that can cause deterioration in diabetes control or diabetes care or blood sugar levels, and vice versa. If you have higher blood sugars and higher HbA1cs or higher changes in blood sugars, that can also impact your oral health, and that can worsen or that can cause increased prevalence of periodontitis and poor oral health. I don't know now. What I don't know, and maybe Dominika can actually let me know if she does know, or anyone know, or even Varkha as well, if she can speak, is that whether improving your, whether I guess we know that really your HbA1c is associated with better oral health, but does improving HbA1c cause improvement in periodontitis? And that's what I wanted to, I would like to think so. I think so, but I have to be sure of that. And I'd like to see if my colleagues do know that. Varkha, I think you're a listener, so if you request for the mic on Twitter, you might be able to speak.
Varkha, can you? I can see you joined the panel. Can you hear us now? Can you come off mute? Is it working? Not at this stage. Seems to be a few little issues. Dominic, can you help with that sort of response?
Yeah, I agree with Amar. It's exactly as he said. The better
Yeah. Varkha, can you hear us now? Yes. Mm-hmm.
lifestyle interventions, diet restrictions, regular exercise, etc. And they all had brief oral hygiene instructions and brief dental treatment. However, this one group had very intensive diabetes management at the same time. And what they found actually with that group that had that is actually there were better improvements in their gum parameters. So we don't have many studies looking at that, but we do have a few, and they are.
Yeah, absolutely. Amar, did you want to add on to that? Yeah, we can go to it and talk a little bit about the guidance. Yeah, go for it. Yeah. Mhm. That's so important, isn't it? It's not just like people are just talking about this. It's actually in that nice guidance. And we did a poll ahead of tonight's chat, and we asked, have you ever spoken about oral health with your diabetes team? And 65% said no. 12 said yes, the healthcare professional mentioned it. 9% said yes, that the individual asked it, and 15% said that they'd like to talk about it. So I assume that they haven't talked about it. So yeah, that you can see there's some lived experience. Like what how does that fit for you guys when you kind of hear that from the community, like listening in, kind of saying that they never speak to their diabetes? The 65% are saying they've never spoken about it, but when it's in the NICE guidelines talking about it, like what's your views on this, and what do we need to do to change the narrative, change the viewpoint of this? What do you reckon? Go for it. Mm.
Health, or to talk about, for example, gum disease in particular. And also, what I found particularly interesting is that there were a lot of barriers because of the differences in the healthcare settings in between medicine and dentistry in the UK. So access to NHS dentistry is really, really difficult. And I think the diabetes colleagues that I was working with felt having those conversations were really difficult as well, because patients, might turn around and say, okay, so this is great that you've advised that I need to see a dentist, but I can't access like seeing a dental practitioner.
Yeah, yeah. Let's bring in Dominika. Well, anything to add on to that? And from a lived experience point of view, 65% saying that they've never spoken about oral health with the diabetes team. What's your thoughts? Yeah, absolutely. Amar, as a diabetes consultant, what's your thoughts? Mhm. Mhm. Yeah. Fantastic. Thank you so much for kind of showing that and telling us a little bit about the road map there, the journey that you guys been on in raising awareness and education, not only for the patient, but for the healthcare professional. So I think that leads us perfectly on to our next segment, about the hub. So could you just go into detail, whoever would like to go for it? What is the hub? Who is it for? You told us a little bit about the backstory. What's the goal, the ultimate goal for the hub? Like, how do you see it going to help people? Yeah.
Diabetes healthcare professionals, for dental professionals, but also for patients. I wanted essentially a one-stop educational hub. And I wanted it to be backed by evidence. So as Amar mentioned earlier, it's all well and good you hear me or someone else say, oh yeah, but the evidence says this or the evidence say that. But actually, I wanted a place where we could summarize all the evidence and it's available for everyone. So what we've done here is we've created this educational platform where we have essentially collated a library of research, guidance, clinical knowledge summaries. So the research spans over 15 years that we've been summarizing to do with periodontitis and diabetes and taking it from the most highly esteemed journals. So making sure that they're really high impact factor journals. So the research that we're summarizing is as robust as it can be. And what we want to do is give our healthcare professionals and give patients the confidence to understand a bit more about periodontitis and diabetes, and for them to kind of have that on their footstep, you know, so they don't need to go looking into things. It's essentially all there for them to get more knowledge about it. So we've created this research library, we've got clinical knowledge summaries, we will soon be getting some video guides and things. So it's essentially just meant to be a one-stop educational hub for all.
That's absolutely incredible. Go for it, Amar.
Yeah, no, I just want to say, so again, I've been fortunate enough to be involved in a number of different online education platforms in various settings, and I must say, you know, this is truly Varkha's vision, and it's amazing. I mean, there are people who, you know, are involved in it, and there's a number of people who probably, you know, we should thank. But certainly, this is all Varkha, and it's amazing that it's a multi-professional kind of education resource. So there's a lot of different content. There's content that could be for people who, you know, are diabetes specialists in whatever form, whatever stage, who want to get a bit more knowledge about oral health. Maybe people who are, you know, in the oral health industry want more information about diabetes, and the people who want both, and everything in between. And I think this has it has something for everyone, essentially. Whatever, you know, whichever side you're looking at it from, it is there about the whole point is about bridging the gap between these two areas. And I think it's an amazing resource. There's a number of different tools available. There's leaflets as well, which people can use. I don't think there's anything like this on the internet. I don't think there's anything like this available, traversing these two areas, and so kind of broad spectrum. There's kind of guidance, you know, from organizations like IPF and Diabetes UK and World Health Federation, I think, but there's nothing that's specific about like this, and I think this is quite unique. I can't remember. I don't think I'm wrong on this, but I have to be corrected. But I think this is something that's quite unique in the way she's done this. Has been, you know, it's amazing to see, and I think it's a really useful resource that deserves to be visited, certainly. And certainly from a professional side, it's something that it's great to have a resource that you can just direct, just click a button, or, you know, send a link anywhere to people, and to highlight across the board.
I think it's like you say, it's across the board. It's for everyone, from patients to professionals in dentistry or healthcare professionals. It's got a mix between research and the guidelines and resources, and a one-stop hub, isn't it, for everything, rather than people having to go look elsewhere. It's trustworthy information with backed up evidence and research. So yeah, it's absolutely fantastic. Going back to what we were talking a little bit before about guidelines and capacity, and we know, like, annual reviews, and they're so busy, and we only get like a short time with our team and stuff like that, and there's so many points within our diabetes care to focus on. Do you think, from your side, Amar, from a consultant point of view, is you could confidently, like, say to your, like, colleagues out there, you can say, hey guys, signpost patients and to go have a look at this, and it'll help raise awareness, and in their consultations it can give them the confidence to talk about it, as Varkha was talking about before as well?
Absolutely. I think there's a couple of things there. So firstly, it's a reason for people, for healthcare professionals, if they're not, again, I speak of this, us three speaking here have been interested in this area for a long time. So we know the data, we've gone through it, we're more aware of it. Anytime we see the link, we will look at something, or look at the articles, look at the evidence. So we're kind of programmed to do this. But a lot of people who aren't aware of, a lot of people who, you know, manage people with diabetes or periodontitis who aren't aware of that link, or who may know it but don't know much detail and want more information. So it helps empower, you know, gives them more knowledge so that they can then transfer that knowledge into clinical care. That's one of the key things. But also, again, we know about, you know, busy consultations. We've got annual reviews in diabetes where we're looking at everything. We have, you know, we look at all the kind of complications and monitoring and everything there. And so adding one more thing to that, whilst it's important, we have to be aware that we may not be able to spend as much time as we want to discussing it. And in some people, it may be, some people might be more particular about oral health, and actually, but that might resonate more than, say, I say, for example, in eye disease or retinopathy. I'm just giving you an example. But so, you know, that might get that link. Actually, you know what? Actually, I didn't know about that. Well, I actually want to look at that. Or I've noticed actually my teeth have been aching, or you know, I'm a bit with gum bleeding. Or I saw a dentist last week, and because there'd be a link, so I might invest. You know, they might think actually that's more relevant to me. And this provides that opportunity for them to understand and learn more, which and in their own time, but also if it's more relevant, can bring it back to the healthcare professional or the GP or anyone to talk about it further. And it provides a resource and a support tool for everyone. I think that's the key thing.
Thank you so much, Amar. Dominika, anything you'd like to add on about the
Yeah, what I think I love the most about the hub is that we've tried to explain complex concepts in very simple words, so everyone without any kind of medical or dental background could understand it. And we also included support tools for people living with diabetes. So, for example, a checklist before they go to the dentist, as very often at few different forums I've encountered these questions, whether they require some different sort of preparation for dental visits. So it's all now in one place. And I really love the idea that Varkha had. So I'm very grateful that I was able to contribute to that.
Absolutely amazing. Like you say, it's accessible, it's inclusive, and I like that checklist. I'm definitely going to have to look at that. I managed to get when I moved to Derbyshire a couple of years ago. I haven't been seen at the dentist for a couple of years now, and I've just moved over to a new team because I couldn't get one. So I will check that list out, because hopefully that'll help me and hopefully reassure me, because it is quite scary at times. Varkha, I know you need to shoot off, and I really appreciate you coming on tonight. But I just want to give you the last words on this section before we go on to the next sections. Was there anything else you wanted to add on to about the hub? Was there anything you wanted to share at this point?
So the Periodiabetes Hub, which is periodiabetes.org, like we've mentioned, is essentially a one-stop hub for all to access. It is essentially a work in progress. Whilst we got the majority of the things out there, it will be something that we're constantly going back on and updating. So we are more than happy for anyone, if they would like to get involved in any means, I think there's a form on the hub that you can fill out. You can get in touch with us, because essentially what our goal is with this is to raise awareness nationally and to essentially just make that voice a little bit stronger. So we will be delighted if anyone would like to join or look at ways to get involved.
That's brilliant. And following tonight's chat, can we can share the links out, and hopefully people get on the hub? Is that all right?
Yeah, that's great. Thank you, Tom, for inviting me and Dominika and Amar. And I'll let Dominika and Amar continue the show.
Thank you so much. We'll be in touch, and great work, honestly. Fantastic work.
Thank you. Take care. Bye.
So moving the conversation on a little bit, which all kind of is so relevant. When I was looking at the notes last night of what we wanted to maybe talk about, I saw on the website actually some statistics about periodontitis, and it says that 1 billion cases are worldwide. So 1 billion periodontitis cases are worldwide, with approximately 19% of the global adult population, and it estimates 537 million adults living with diabetes worldwide, and it's also projected to increase periodontitis over the next sort of 10, 20, 30 plus years. And I guess having quality resources like the Periodontitis Diabetes Hub is just tremendous. And as Varkha says, I think she undersold a little bit at the end to say that it's not completely there. I looked last night, and I think it's a really comprehensive website. And what I do like of what she says is you guys are going to continue to grow with it, so you can add more research when things develop, if the guidelines change or anything that needs to be added. I like the checklist idea, Dominika, or the lived experience. So already is a very comprehensive platform, but it's not going to just sit still in the moment. It's going to keep evolving with the times, and especially when you look at some of them stats.
I agree, and you've also got clinicians, you've got dentists, you've got diabetologists, you've got people with diabetes, Dominika, people who are involved in this. So it's something that you can hopefully trust what it says, and that trust that we're looking at it from our perspectives, but actually giving you kind of something you can, something that you can utilize, something that's worthwhile, relevant, and believable. I think we're not just doing things ad hoc. But kind of there's quite a robust process there, so it's a good thing to have. And again, we'll come back to the stats and figures about diabetes, people with periodontitis. About a billion. It's about over 800 million people with diabetes in the world, probably a bit more than that now. So again, you can imagine the overlap, and we know, sugar generally affects dentition. Sugar in the bloodstream will affect that as well, and so you can imagine there's a lot of crossover with the prevalence of both. So, people having diabetes and periodontitis and vice versa. So again, it highlights why we're not talking about small numbers here. We're talking about decent numbers.
Yeah, absolutely. Dominika, bring you into it as well.
Yeah, I think the numbers show clearly that this is the topic which needs our attention. And once again, I'm just glad that we were able to collate all of the resources in one place, because so far you could hear that there is a connection, and there were a lot of information on a few different websites. But I really wanted to have a space where I could find it all sort of like in one place, and hopefully this is also going to be a place which would help people living with diabetes to find the information they're looking for when it comes to oral health and diabetes.
Yeah. So how can we sort of make periodontitis sort of an oral health, diabetes, oral health part of them annual checks, more like, how can we get it to be talked about more, involved in that sort of annual screening? How can we do that? Like, what's the next steps, do you think, to do this? Because like you say, you've got the guidelines, you've got all this incredible research that's spanning 15 years, you've now got this incredible platform that's growing and growing. Like, how can we change the narrative in clinics so that it is mentioned? Because like I said before, it's not overly talked about. Do you think it will just happen? It'll just, over time, will awareness and it'll get out there more? Or what do you reckon?
So I think it's a long-term work, but we should start with the enhanced training dedicated to the healthcare professionals. Because as far as I know, the dental classes in medical school are very limited. So we should equip healthcare professionals with more knowledge related to oral health and how it can affect the diabetes management as well. And as a second step, we should put more attention to establish more integrated care models where we could combine the work of diabetologists with the work of dentists.
Mm-hmm.
I can't add more than what Dominika said. I mean, that's perfect. Yeah, I would exactly that. So, having been kind of on the medical side, as I say, on the diabetes side, and being involved in this for some time, I think one of our mutual colleagues is called Zara Yonel, who
yes,
is an amazing researcher. This is one of the leading researchers in this area in the world, I'd say, but certainly in the UK.
In the world.
In the world, yeah, absolutely, yeah. I agree. Yeah. No, I'm called out. Perfect. Yep, I agree. So she, I got to know her again. Probably was been about 10 years, maybe under that. So that's when I started getting interested in this area, and the dental teams, dentists are actually more clued on and more interested and more supportive and working towards ways of understanding this and trying to resolve this and trying to look into that, trying to support screening for type 2 diabetes in people with periodontitis, looking at age disease, looking at blood sugars, or identifying those who could be at risk of diabetes or have diabetes in those who they see with periodontitis. Whereas the other way around, we haven't been up until more recently. And so actually, as diabetologists in the diabetes community, we're probably not doing enough comparatively. And so we need that awareness piece, that knowledge piece, that implementation to practice piece needs to be also from us. If you look at conferences, for example, where a lot of healthcare professionals gain their interest about 5 years ago, there wasn't anything even 3 years ago. So 3 years ago, there wasn't much on oral health and diabetes in the diabetes conferences. However, in the oral health conferences and perio conferences, there was a lot about systemic health and diabetes. So they were already ahead of that. I mean, more recently, and partly being involved in some of these, I've been able to bring a bit more of oral health in the diabetes conferences and meetings, and actually in the more awareness. And with Diabetes UK now also, there was a session on oral health last year. It was also a few other conferences where this was mentioned. There's actually a website on the Diabetes UK website, or looking at this webpage about oral health. Nice guidelines have come in. So in the last 3 years or so, that's starting to change more. But it's about that integration and that implementation piece that Dominika mentioned at the end, just so important, and how we do that, how it works, especially in a system such as the UK, where there's a mixture of private and NHS, and people don't always communicate. I think primary care has a lot to do in this situation, but again, primary care is doing everything else as well. So it's how do we fit that in appropriately, whilst also developing the research and understanding a bit more about it. So that's something that a lot of people are working on. That's something that probably needs a bit more focus, but certainly from our side in the diabetes realm, we need to do it more.
Yeah, totally. And I think it's really good to hear, Amar, you say that it's been talked about more at these conferences, these events where healthcare professionals go to and learn and hear about different technology or different treatments and different therapies, etc. So I think, and I value like hearing about it, hearing you say that it's on the agenda, it's been talked about, and now, like you say, with the guidelines a couple of years ago, and the movement is hopefully in a good place right now, and hopefully continues to get out there and help people. So thank you so much. We do have
Tom,
Yes.
I just noticed that one of our best worked oral health researchers joined this discussion, and Zara is here. So
She is.
maybe she would be willing to share a few words about
Absolutely.
her research as well.
Hopefully she caught me saying she's the best researcher as well.
She must have been listening in, guys. She must have heard. I'll see if I can bring her up. I see all her incredible things that she puts on Twitter, and I think she's absolutely phenomenal. Claire, I don't know if you can bring her up because I'm having some issues my end. Let's have a look.
I must admit, I didn't hear the bit where you said I was a good researcher. I logged in too late. I was working, I'm afraid. I missed that.
I said you're one of the best in the world.
Oh,
Yes.
well,
And then I changed to UK, and then Dominika corrected me.
well, thank you very much for that very kind compliment. And I'm so sorry I've missed the start of your talk. Unfortunately, I was working late tonight.
No problem at all. I think the guys have been absolutely tremendous. Dominika, Varkha, and Amar. I just think raising awareness about diabetes, oral health is so important. And talking tonight about periodontitis, I've learned so much myself, and I think hopefully it's changing that narrative. It's moving forward. Like you say before, there has been intense research for the past 15 years. Was there anything you wanted to share from your point? Welcome to the chat, by the way. But was anything research-wise or any messages, key messages you wanted to share in this opportunity that you've come to now at 9:15 on a Monday night?
Thank you so much. I'm going to firstly start with an apology because I'm probably going to end up repeating some of what Dominika, Varkha, and Amar have already said. But I guess the key thing for me is just integrated working together as a team. We all want the same thing, really, to improve the lives for people living with diabetes, right? The quality of life, reduce stigma. We know that there's a huge amount of stigma related to both type 2 diabetes, well, diabetes generally, I guess, and periodontitis. We know that they're non-communicable conditions that share lots of risk factors. There's lots of opportunities here for healthcare professionals to work with people living with diabetes to hopefully try and improve quality of life. And it's just about getting that message out there, really, that we're a resource here as dental care professionals who want to be supportive, who want to help, and who are able to risk assess for periodontitis. And as my research has shown over the last 7 or 8 years, I guess, that actually as healthcare professionals in oral health settings, so dental clinics, we are able to also successfully risk assess and identify type 2 diabetes early. So there's lots of scope, I guess, for integrated working. And it's something I think we just need to kind of amplify, and a message that we need to really get out there, so that those people who are living with diabetes are aware of their periodontitis risk and aware of what they can do to manage it. Because it's not just about scaremongering. People who are living with diabetes have a million and one things to think about. The last thing they want to be worrying about is their oral health and the status of their gums. And if their time in range is good and their diabetes control is generally pretty good, actually the risk of periodontitis is no higher than that of the general population. But we know in people who aren't able to, manage their diabetes as effectively as they'd like, then actually they are at higher risk. And we as oral healthcare teams can help to try and mitigate some of that risk through some of the interventions we're able to deliver within the dental practice. So I guess it's just, as I say, amplifying the message that the two conditions are linked, and that actually it's not all bleak and bad news. There's things that can be done to support people, and as a healthcare professional, that's what we're here for, to try and help and support where we can.
That's go on, Amar, sorry.
Yeah, so I keep going in. Sorry, I'd also pick you up and say, again, as I said before, in terms of dentists and dental professionals being ahead of the game with this, I'd say in research side of things as well, I don't think we're doing enough in the diabetes side to explore this more. For example, we're looking at trials in various settings and data when we're looking from a diabetes perspective. One of the things, besides the retinopathy, neuropathy, HbA1c, and all the things we look at, we should perhaps consider oral health and periodontitis perhaps in that data collection to analyze, to get more evidence towards this and to build that evidence base and to strengthen it, because we know it's there and it's enough to change guidelines. So actually we need more data. So I think from our diabetes community, our diabetes research community, we need to do a lot more.
Yeah, and do you think, I went to a symposium at DUK, I only got to 2 actually, due to work, and it was Parthas, where it was talking about the MDT teams and the roles and the different sort of positions. Do you think that the dentist role should be included in this holistic, this whole approach to support that person with diabetes?
I was in that talk as well, and one of my colleagues, Tara, I bullied to get up to the mic. I said to her, it's really noticeable that podiatry and dentistry were left out of the MDT.
Yeah.
And it was a very interesting talk to listen to, and obviously they were discussing the politics and the funding streams and the dynamics within the team and the challenges of the team currently face. And I think there's still a kind of feeling around dentistry that it's just teeth. And people seem to forget that actually I'm not talking economic costs, leave economics to one side for a moment, but actually the costs to individuals who lose teeth or have toothache or are unable to function in terms of, if you think about all the functions of, simple thing like a smile, being able to eat high quality food, being able to chew, being able to talk, all these functions that we take for granted, you can't do as effectively without your teeth, and that really impacts therefore on quality of life for patients. And I think we've got to stop looking at things necessarily in just from an economic point of view, but think of what our patients want and what our patients think is important to them. And we know that actually tooth loss is one of the major causes of psychosocial anxiety and problems for patients, and I think it's something that really we've got to be adopting a much more holistic approach and stop thinking of the mouth as a separate entity to the rest of the body, and start thinking of how we can work together. We're not competing. We're there with the same goal, try and improve in quality of life and try and make things better, easier, more successful for our patients. So I definitely think oral healthcare professionals should be involved in MDT, but it's just how one goes about doing that.
Yeah.
If you think about the numbers of dental kind of dentists with an interest in periodontitis, trying to get them into MDTs, we're quite a small profession comparatively. There are practical challenges there that we still need to overcome. But until we start getting our voices heard, a seat at the table, we're never going to be able to grow that. We're never going to be able to start to tackle those obstacles. And that's where, when I talk about amplifying kind of the noise around oral health in diabetes, we're not going to get opportunities and the kind of to grow the research and to get the care that I think people with diabetes deserve. If you think about pregnant women getting free dental care and dental checks, now obviously that's not there yet for diabetes, but in my mind,
do you think it should be?
People at high risk, yeah, not necessarily everyone with diabetes, but people who our secondary care colleagues are seeing, who we're struggling to get their time in range appropriate. They're quite high glycemic levels, people who have got foot ulcers, other equally microvascular problems. They are the people at high risk, and they're the people who we should be seeing in a dental clinic.
Yeah, I totally agree. Yeah, Dominika?
Yeah, I couldn't agree more with Zara. I think, when we take into consideration that as a people with diabetes, we should have regular eye screening, etc. I believe that we also should have regular periodontal screening, as we are on a high risk for periodontal disease. And especially during the times where access to NHS dentistry is so limited, there should be a priority for people with chronic disease like diabetes.
I 100% agree. I think if there was a screening process that you could do, like you say, like you have, like with your eyes or your feet check, things like that. And then if you were sort of, I guess, scaled, you guys, the professionals here, and if you're at more high risk, like Sarah was saying, is that then you could like go through that sort of support and treatment and stuff like that. I think it's really, really fascinating. And very, very important. I think all the work that you guys are doing is tremendous. And we've got a comment from here from Gillian. She says, my first dental checkup post type 1 diagnosis showed oral health deterioration, but 6 months later, when my A1C was much lower, things had improved significantly. Makes me realize why dentists can spot diabetes early. What's your thoughts there?
100%. It's something that we see all the time. So I'm sure I've come to this chat late, so I'm sure the others have already mentioned this, but there's obviously an incredibly strong bidirectional association between the two conditions, and we see it all the time, whereby if you can get the patient's diabetes control improved, our job in the dental clinic is so much easier, because the treatment we need to is far less aggressive. The gingival tissues or the gum show much less inflammation, and from our point of view, it makes managing a patient's oral health significantly better. I've recently just finished filming a video with a patient that I've been treating here in Birmingham, and they wanted to do like a testimonial, a story, because of the impact that it had on their life. The patient came to see us with such severe gum disease, and their dentist just couldn't get it under control, so referred them into the hospital. And I said to them, have you been tested for diabetes? Oh, no, I don't have diabetes. What makes you think you don't have diabetes? Has a healthcare professional told you this? No, I just, I don't have any signs or symptoms of diabetes. So, well, in which case are you happy for me to do a test? Because worst case scenario, like, it's a small blood test, and, either we prove you right that you don't have it, or actually we find out that you do, and we're able to, get some management. Their HbA1c was 111 millimoles per mole.
Wow.
So absolutely through the roof. and they had no signs or symptoms of diabetes that they were aware of. The first sign that they showed was that they had multiple abscesses in the mouth, they'd lost multiple teeth, and they had really severe gum disease. We've managed to get them obviously seen, and their diabetes is now really tightly managed. And it's been less than a year, and their gum disease is completely under control now. They're completely periodontally stable. So from my point of view, it's really important that we work together with our medical colleagues, because actually in getting this patient diagnosed as soon as we did, it meant that A, her general health has improved, B, her gum health has improved, and most importantly, in that video, she talks about the impact it's had on her day-to-day life, and how actually she's more confident in herself. You know, psychologically, she feels so much happier and in a much better place in terms of her mental health, because actually the impact of having so many dental appointments, no one being able to get it under control, her having the stigma around, you know, losing teeth and not wanting to speak in public and so on and so forth, you know, working together to get better outcomes for our patients is just so important. So the story that you just mentioned, or the comment that you just read out, doesn't surprise me at all, really, because if you can get one disease process controlled, the other one generally falls into check too.
Yeah. Wow. Honestly, thank you so much. Thank you. Great question from Julian and fantastic response. What a fantastic chat, guys. So insightful. I've learned a heck of a lot. And we will send out the link to the new hub, the periodontitis hub, for you guys to go have a look at. Like the guys have already said, lots of resources on there, guidelines. I didn't even know about the guidelines. That like is astonishing. I've only got to know that the last couple of weeks. So I've learned a lot. I hope other people listening tonight, or when they do listen back, do learn a lot. And honestly, thank you so much. Keep up the fantastic work. And I think us people with diabetes would, if we could come up with the answer, Dominika and Sarah, is that we would have you guys at the table, part of the MDT, working together in collaboration in the best interest for everyone. So we're behind you 100%. And I'm sure the medical professionals out there in the majority definitely would, but there's obviously other things that can sort of not allow it to go. You know what I mean? So thank you so much, Dominika, Amar, also to you, Sarah, for coming on tonight. And we'll have to do another one because there were other questions we didn't get to. But honestly, thank you so much. Yes.
We've had a question from Linda come through.
Okay. Go for it, Claire.
Could you give information on burning mouth syndrome with type 1 diabetes?
Hello, sorry, can you just repeat that? Do you want some information regarding burning mouth syndrome?
Yeah, can you give him some info on burning mouth syndrome with type 1 diabetes?
So I'll be completely honest, burning mouth syndrome is not my area of specialty. Burning mouth syndrome is something which is reported in relation to diabetes, as are other taste disturbances. What I would say is, when any patient has burning mouth syndrome, the first thing I always do is check their iron levels, hematinics, B12, ferritin, folate, because often it can be linked to deficiencies in that regard. In terms of burning mouth syndrome itself, a lot of the management is kind of topical, of avoiding spicy foods, anything acidic, and tailoring your diet. But there are, I don't know if it's for yourself or for one of your patients, but a referral to an oral med department is probably what you need.
I think it kind of links to the whole nerve dysfunction, doesn't it? And nerve damage.
Yes, correct.
With this, like, you can get that from a number of different causes. So same thing with neuropathy and peripheral neuropathy and diabetes, or otherwise we do a lot of tests to understand is any other reason for that nerve damage. B12 as Sarah was mentioning. But if it is, and if you're looking at someone who's got high HbA1c or dysglycemia or raised blood sugars, then that'd be something I'd want to improve. And I'm sure, as I don't know about the evidence behind it, but I would suspect that, as with all neuropathy, well, early onset neuropathy as well, if you can improve that blood sugar control, then you can reduce those symptoms and then reduce the nerve damage.
Thank you, guys. Laura says, such a great subject to discuss, a complication that gets little discussion in clinics and then little help once the complication occurs. Thank you for your comment, Laura. Got a question, if that's, we've got two more little bits, if that's okay, guys. Got a question that's come in to say they haven't been seen by a diabetes team in a while and are worried about their sort of oral health. What advice would you give them to move forward?
So is that they've not seen the diabetes team in a while? Again, it depends, I guess, who there's the overall just general looking after your diabetes and the people you want to see for there. It could be a primary care team, it could be a secondary care team. It's just notifying them. Obviously, it's the annual reviews, but if it's something specific, you can always make an appointment with certainly the primary care team, but also if you have contact with your diabetes nurses or your consultant or your team, you can contact them to say you feel like you need a review. They should hopefully be able to try and get you an appointment or speak to you at least on the phone. And I guess in regards to the oral health side of things, again, it's about raising that awareness. So I would certainly ask them about it. If they don't know about it, then it's certainly something that now you can probably empower to highlight to them about the resources available, but also you're also aware now as well that about the links. So it's about perhaps seeing and checking if you are concerned about it. Again, making sure you attend your regular dental, or dentist reviews once a year at least, or depending on every other frequencies. But making sure that gets checked. That's probably the basis of the standard management. In specific, it's about identifying things that can help optimize your blood sugars as best as they need them to be, and also speaking to the right teams. I think it's the first step. And I agree. I understand that in this kind of situation with everything, appointments are not easy to get hold of. But it's important to alert the teams and then to speak and meant that you got to your diabetes review, and it's always primary care team to kind of see a bit sooner rather than secondary care if you're not able to get hold of them.
Yeah, one thing I would add on the top of that is that if they are not able to see the dentist, it might be even worthwhile to see a hygienist instead, because these guys, they also have plenty of knowledge about the gum disease, and they can also give you a lot of advice regarding the treatment and management of current condition.
Thank you both. How do you go about doing that, Dominika, hygienist? Is that through the sort of dental surgery, or do you have to? Is that through diabetes team? Like, how do you do that?
So usually at each dental practice, there's at least one dental hygienist who works there. So it might be worthwhile to approach them. I also come up with the idea that it might be worthwhile to visit the students at the university. I'm not sure how it works exactly within the UK. Zara might be able to help with this question, but in my place, you're able to see the dental students who are working under supervision of seniors at the universities for free. So that's one of the alternatives.
So unfortunately, that's a little bit more challenging here in the UK. Yes, undergraduate students do treat members of the public under supervision, but actually there's such long waiting lists to get in to see a student, and the patients are vetted for suitability for students, such that actually it's not really feasible or practical. And where we have what I would consider patients who have a higher level of need than, say, Joe Public, or a higher complexity level, perhaps seeing an undergraduate here wouldn't be ideal. Nowadays in the UK, you don't need to have referral from a dentist to see a hygienist. There are many hygienists who work under direct access. So you can just walk into a dental practice and say you want to book an appointment with a hygienist and get booked directly with a hygienist without having to see the dentist for a checkup first. And most hygienists will, well, all hygienists will be able to screen for gum disease and undertake the initial management stages that are required, i.e. helping patients to ensure they're undertaking the most optimal oral hygiene regimes through demonstrating techniques intraorally, and also by cleaning above the gum line, and also where required cleaning below the gum line with local anesthetic. Anything that requires further management or more complex management options can then be referred back to a dentist within the practice.
Right. Yeah. And could that potentially speed up the process if you're seen by the hygienist and they identify some of them sort of key markers? Could that potentially speed it up, or is it just dependent on this?
Yeah, so it can speed things up a little bit because, as we know, it's very difficult at the moment in the UK to get access to NHS dentists. Also, it can be a more cost-effective way of doing it, certainly. And it's well within the remit of a hygienist to, like I say, identify any issues and then triage. If they think it's too complex and more specialist services are required, they can refer patients into those services as required. So again, speeding up the process for which a patient gets to the member of the dental team that's most appropriate to treat their needs.
That's brilliant. Thank you. Got one final question before we just finish up is, do you have any sort of dental plans, or is it like insurances that you can take out for like dental treatments and stuff?
Did you want me to take that, Dominika, or do you want to take that one?
Yes, please take it, sir.
Okay, yeah, sure. So within the UK, there are definitely dental plans. The problem in UK dentistry is very fragmented. So there are plans, like sort of most famous dental insurer is probably Denplan, where you can take out, you pay a certain amount every month, depending on your package, you get a certain amount of treatments within that. Some dental practices have their own sort of payment program. But certainly there are lots of insurers that will cover dentistry, but it's just worth comparing them and finding out what best suits your need. Some people might have a higher caries or tooth decay risk. Some people might perceive themselves to have a higher gum disease risk. Different plans will fund different things. And universally, there are some things that dental plans won't fund. So you'll need to do a little bit of investigating, but there are certainly plans out there that can work out to be more cost effective when it comes to having regular dental checks and regular dental treatments.
Thank you so much. So, guys, just to conclude tonight's chat, if we can go around, Amar, Dominika, and Sarah, what would your sort of final points or concluding points be? Any final messages or advice? What would you like to summarize to finish from tonight's chat individually? Dominika?
I think that I would give an advice that if you notice that your gums are starting to bleeding, don't wait, but act and see a periodontist as soon as possible, because if you would have a wound in your eye, you wouldn't wait that long.
Thank you so much. Amar?
Sorry, there we go. I would echo something similar to that. I would say if you if you have, obviously people listening, if you have diabetes, be aware of the link with with your dentition, your oral health, and periodontal and inflammation of your gums. And also, if you do get the information of your gums, be aware of this link with your diabetes. So check, make sure, if you check, see what your blood sugars are doing, see what you've had, recent, look at your time in range, look at your recent HbA1c, and see if there's anything that can that can be looked at from that perspective. So both ways, be aware of both, because they will both have impact on each other. Don't be afraid of alerting your healthcare professional to that as well, because they should ideally know, and if they don't know, as part of the process, they need to be looking at it. And if they don't know, then they still learn. And we all learn from everyone. We learn from yourselves. You're the experts. So it's important that you also, people who are listening to this, they've got that knowledge now. And the other thing I'd say is also make sure you check the Period Diabetes Hub as well. That's the resource.
Absolutely. Thank you so much. It's been a tremendous chat tonight. Lots to take in, and thank you so much for coming on, for talking, and just bringing your wealth of knowledge and expertise tonight. So thank you so much.
Thank you all.
Thank you all.
All right, guys. Thank you so much.